Severe outcomes in COVID are very uncommon in children. In fact, children are the least impacted age group by COVID overall and by severe COVID. But in children that do experience severe COVID, there's the risk of multisystem inflammatory syndrome in children, which can be lethal. New research out of Harvard shows that leaky gut is a connection to determining which children have multisystem inflammatory syndrome and lethal outcomes. And they also show in the study that preventing the leaky gut reduced the hyperinflammation, the cytokine storm, and improved the clinical outcomes. So, could improving your gut save your child? Let's dig into that today. I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimum. Children are the least affected age group by COVID infection. There's a small group of children, though, who weeks after COVID exposure develop multisystem inflammatory syndrome, which can be lethal due to heart outcomes or cardiac impact. And so research is ongoing to determine what determines which children experience this and why the majority of them are asymptomatic and recover fine. And a study in Harvard is revealing that leaky gut is a connection. What they found is that the longer the SARS-CoV-2 stays in the gut, or the COVID stays in the gut, the more it promotes intestinal hyperpermeability, or leaky gut. And there's a marker you can test to observe for leaky gut. And they did that in this study. That marker is called zonulin. And so in the study, they took 100 children, and 19 of those children had multisystem inflammatory syndrome, 26 of those children had acute COVID, and 55 of those children were normal controls. What they did is they looked at the stool of these children and the blood for markers of inflammation. In the blood, they looked for markers of inflammation, spike protein, etc. In the stool, they looked for zonulin and COVID. And so they established presence of those things, and then they followed them to see how leaky gut impacted outcomes. In one child, they treated them with a zonulin antagonist medication called Lorazepide. And they did that because they wanted to prove their concept of, does leaky gut contribute to MISC and severe outcomes? Well, this child had MISC, multisystem inflammatory syndrome, due to COVID, and in giving this child the Lorazepide, or the zonulin inhibitor, what happened was a reduction in zonulin, improvement in mucosal barrier integrity, reduction in systemic inflammatory markers and cytokine storm, and reduction in virus antigen, spike protein found in the blood, and the associated improved clinical outcomes. So this is a proof of concept study suggesting that zonulin inhibition and promotion of gut barrier integrity, or prevention of leaky gut, could be key to preventing multisystem inflammatory syndrome in children with severe COVID. And if they develop it, addressing that could be key in saving their life and reaching optimal outcomes. So this is a study that again reinforces the importance of gut health, and it's not to be taken to say leaky gut causes severe COVID, but it's one contributing factor, and it's one that we can all choose each day to improve upon. And there's many actions we can take to promote gut health and gut barrier function, which would then prevent COVID from going systemic, driving cytokine storm, heart conditions, and death in children. So if you needed another reason to think about gut health and immune health, and also to promote gut and immune health in your child, here's one out of Harvard.